This is a video of a simulation of nutrition-focused physical examination, where a comprehensive head-to-toe assessment of muscle loss, fat loss, and signs of micronutrient deficiencies is examined by a registered nutritionist and dietitians in clinical settings. Upon entering the room, explain the purpose of the exam to the patient and make sure to ask their permission. This helps them have an overview and be more comfortable throughout the examination. For general inspection, the dietitian may first inspect the patient's overall appearance, posture, and demeanor. This is also where essential information such as their weight and dietary habits is collected that will be key points to assess their nutritional status holistically. To examine the upper region, start with the hair by asking how it has been easily pluckable, dull, or have observed any physical changes. Next, palpate at the orbital region for loss of subcutaneous fat. Use the index and middle finger under the eye above the cheekbone. Ask about any changes in the vision or difficulty at seeing at night. Use a pen light to examine for abnormalities in sclera. Look at the mouth for signs of micronutrient deficiencies if there's cracking or lesions. Using the pen light, make sure to examine the teeth, gums, tongue, and insides of the cheeks for any abnormalities or discolorations. Don't forget to look at the buccal or cheek region to examine fat loss. Also, examine the temple region for muscle wasting. Ask the patient to make a chewing motion to feel the muscle. Use the thumb to palpate horizontally, diagonally, and vertically. A depression in temporal region may indicate severe muscle loss. When assessing the clavicle area, remove any obstructions like adducens. Make sure that the patient is sitting upright with arms relaxed on both sides. Using the pads of fingers, palpate below and above the clavicle bone along the acromion process. To examine the upper arm region, the tricep, ask the patient to bend their arms about 90-degree angle and gently press the skin with 4 fingers to separate muscle to fat. There will be ample fat in this area for well-nourished individuals. At this point, the dietitian may check the patient's skin for any abnormalities like discoloration, signs of petechiae, and skin turgidity for hydration status, all the way to assess muscle loss in the interosseous muscles by asking the patient to make an OK sign. They may also examine the nails for any blanching, contours, and lesions. When examining the scapular region, have the patient's arm press against the wall or your hand to help engage the muscle. Palpate around, above, and below the scapular region to assess for muscle loss. To evaluate the iliac crest, examine the ribs, lower back, and mid-axillary line. A well-nourished person will have a full chest with ribs not visible with slight to no protrusion of iliac crest. There should be ample fat to feel before the bone. To assess the patellar region, have the patient's knee bend and make sure that the back of their knee is not resting against something. A well-nourished individual has protruded quadriceps muscles and a knee bone that is not prominent. To assess the muscles in the calf, gently press it to determine the amount and quality of muscle present. It should have an adequate bulk of muscle and firm in texture. The dietitian may also assess the foot to evaluate for fluid retention or edema present by pressing firmly the top of the foot or the tibial bone. Edema may be graded at 0 to 4 depending on length of time and depth of pit. After completing the exam, you may share your findings to your patient and thank them for their time. This is Micaela De Leon, together with my members, students of Nutrition and Dietetics from Polytechnic University of the Philippines. Thank you so much for watching.